компьютера. Так, ты вошла в зал ожидания. Ну, выключить звук, да, нажать? Слышно или нет?
Да.
Слышно, да? Ну ты скажи, а то я не знаю. Такое молчание.
Но у меня микрофон был выключен.
Ну ладно. Значит, они слышат, выходят, да? I don't know, I explained you this or not, but I will repeat them. You may see how azoles inhibit ergosterol synthesis at the step of formation of toxic 14-alpha-methylsterol. And this toxic 14-alpha-methylsterol is incorporated into cytoplasmic membrane and causes damage of this membrane simply. So you may see disrupt the tightly packed acyl chains of the phospholipids in fungal membranes. Destabilization of the fungal membrane leads to dysfunction of membrane-associated enzymes, including those in the electron transport chain, and may ultimately lead to cell death. Fungicidal effect develops. Well, go on. Those, they, as I said before, they act, inhibit growth and division of, and may kill wide range of fungi may be used in different fungal infections. They are useful against a lot of fungal pathogens, such as cryptococcus and some others, candida, aspergills, and so on. And they may be fungistatic, but in some circumstances may be fungicidal. Azoles, antifungal agents, can be divided into two broad classes, imidazoles and triazoles, which share the same mechanism of action and similar antifungal spectrum. Commonly, triazoles tend to have less effect than systemically administered imidazoles on human sterol synthesis. That is, toxicity, it means that toxicity of triazoles is much less than toxicity of imidazoles. Imidazoles were the first drugs among this group which were introduced in the clinical practice. The imidazoles include such drugs as ketoconazole, was the first drug which was introduced into clinical practice in 70s. Then a lot of such so-called topic azoles, such as clotrimazole, miconazole, econazole, and a lot of others. There are a lot of drugs which belong to this subgroup, topical azoles. So they are used only topically for the treatment of superficial fungal infections. Of hair, nails, and some, and mucosa also. Ketoconazole is available in both oral and topical formulations, so it may be used orally and topically. But the matter is that this drug is more toxic than triazoles, drugs from triazole group. It inhibits not only 14-alpha demethylase, but also inhibits enzyme called 17-20 lyase and causes inhibition of adrenal gland and gonads synthesis of glucocorticoids and androgens, steroid hormones. Therefore, it may cause such adverse effects as gynecomastia and impotence because inhibits androgen synthesis, but also inhibits glucocorticoid synthesis and can cause some adrenal insufficiency. It is adverse effects which limit the use of ketoconazole for systemic infections. But it is interesting that ketoconazole may also may be used not as antifungal drugs, but may be also used to treat Cushing's disorder, that is to suppress glucocorticoid synthesis, and also may be used for the treatment of prostate cancer because in this case inhibition of androgen synthesis is required. What is necessary to say about toxicity of ketoconazole? Of course, it can cause also hepatotoxic effect. All azoles can cause it to different extent. Ketoconazole to more extent than others, especially triazoles. And then ketoconazole inhibit drug metabolizing enzymes, as was said before. What does it mean? It means that toxicity of drugs which are metabolized by these enzymes increases. I can give you example. Ketoconazole is effective against fungal infections which may develop in immunocompromised individuals, for example, when these patients undergo immunosuppressive therapy with cyclosporin. When it may be in organ transplantation. Maybe you remember about immunosuppressive drugs that cyclosporin is the main drug to suppress immune response to prevent graft rejection in organ transplantation. And if ketoconazole is used in the case of aspergillosis caused by immunosuppression, growth of aspergillus, it may inhibit enzymes which metabolize cyclosporin. In this case, toxicity of cyclosporin will increase. What are toxic effects of cyclosporin? Remember, it is nephrotoxic effect, hepatotoxic effect. Therefore, such very undesirable adverse effects of cyclosporin may increase if cyclosporin is used with ketoconazole. So ketoconazole in this case is not recommended for the treatment of aspergillosis caused by cyclosporin. Cyclosporin caused immunosuppression, of course. Then about triazoles, which are less toxic and are widely used for the treatment of systemic infections, but as I said before, may be used for the treatment of superficial infections also topically. I will give you information about only 2 drugs from this group, but there are a lot of. Itraconazole is available in both oral and intravenous formulations given in broad spectrum of activity. Itraconazole has largely replaced oral ketoconazole for the treatment of many mycosis, including aspergillosis. Itraconazole is very effective against aspergillus. Fluconazole is widely used now, the most widely used antifungal drug nowadays. Fluconazole is hydrophilic triazole that is available in both oral and intravenous formulations. The bioavailability of oral fluconazole is nearly 100%, and unlike ketoconazole and itraconazole, its absorption is not influenced by gastric pH. I listen. What? Have you questions? Так. Наталья Геннадьевна, не знаете, что он поднял руку? Угу. Yeah. So you see that such drugs as ketoconazole and itraconazole, the absorption depends on pH of gastric medium. They are not well absorbed in, better absorbed in acidic medium than in alkaline medium. Therefore, they cannot be used together with such drugs which inhibit production of hydrochloric acid or neutralize hydrochloric acid, such as omeprazole, such as antacids, and so on. But you see, these drugs don't influence absorption of fluconazole. It is, of course, some advantage of that. Fluconazole very well penetrates through gastrointestinal, through blood-brain barrier into cerebrospinal fluid, and therefore it is considered to be the first-line treatment of cryptococcal meningitis. for the meningitis caused by cryptococcal infections. And now about flucytosine. But at first, let's look at the picture. Flucytosine inhibits DNA synthesis as a whole of fungal DNA and fungal cells. At first, it must penetrate into fungal cells by enzyme permease. Without permease, it doesn't enter the fungal cell. But when fungal cells have this enzyme, therefore they provide the entrance of flucytosine inside cells. Then flucytosine undergoes action of cytosine desaminase. So it is converted by cytosine desaminase into 5-fluorouracil. This is compound. And then to some other substances which finally inhibit thymidylate synthase, which is necessary for the synthesis of nucleosides which are incorporated into DNA chain. As a whole, it leads to inhibition of DNA synthesis. Let's look. So flucytosine is converted to 5-fluorouracil by cytosine desaminase. Then 5-fluorouracil is converted to 5-fluorodesoxyuridylic acid monophosphate, which is a potent inhibitor of thymidylate synthase. Inhibition of thymidylate synthase results in inhibition of DNA synthesis and cell division. But it is mainly fungistatic, not fungicidal. So you see, flucytosine needs permease for penetration to the cell and cytosine desaminase for conversion to active substances which inhibit DNA synthesis. But human cells, they have no such enzymes. Therefore, flucytosine is rather unique for the treatment of fungal infections. So it acts on with the help of such targets which are not present in human cells. But unfortunately, it causes some toxic effects because flucytosine may be converted to this 5-fluorouracil by enzymes in the gut, by bacterial and fungal enzymes of bacteria and fungi which are present in intestine. So they convert flucytosine after oral use into these substances which inhibit DNA synthesis, and therefore flucytosine can cause some adverse effects. About griseofulvin, inhibits, let's go back to flucytosine. Which adverse effects are common for such substances, such drugs which inhibit DNA synthesis? Remember, we discussed it a lot. I would like you to remember now. Who can answer this question?
Нажмите на участников.
Adverse effects of cryptococcal. Do you want adverse effects of cryptococcal?
Хотят уточнить вопрос.
А,
Обычные эффекты гризиофульвина вы хотите?
нет, нет, нет. Listen, please. I would like to hear about common adverse effects of flucytosine. Because its mechanism of action results in inhibition of DNA synthesis. As I said before, with the help of bacterial and fungal cells which are present in intestine, human intestine, flucytosine may be converted to such substances which inhibit DNA synthesis. And my question is, which adverse effect results from inhibition of DNA synthesis mainly?
Bone marrow suppression can be there.
Yeah,
because
well, good. Excellent answer. Well, I am satisfied of your answer. So may cause some bone marrow suppression, and therefore may develop neutropenia, anemia, and some such adverse effects.
thrombocytopenia.
Yeah, about grisofulvin. Inhibits fungal mitosis by binding to tubulin and microtubule-associated protein. And thereby cause disruption of mitotic spindle assembly, disruption of assembly of mitotic spindles. The drug is also reported to inhibit fungal RNA and DNA synthesis. Grisofulvin accumulates in keratin precursor cells and binds tightly to keratin in differentiated cells. So you see, it is accumulated in newly formed keratinocytes, not in those keratinocytes who are already infected. And what is the consequence of this? The matter is it takes a lot of time for complete recovery from, for example, onychomycosis. Onychomycosis of toenails is treated by grisofulvin for a long time. It takes about 12 months for complete recovery from toenail onychomycosis with grisofulvin. It is used only orally. Of course, it has adverse effects. Not so many, but the main adverse effect of grisofulvin is headache, which disappears only after withdrawal of the drug. Therefore, of course, nowadays grisofulvin is not among first-line treatment of onychomycosis. We have better drugs such as terbinafine, which inhibits allylamide, which inhibits ergosterol synthesis at the step of squalene epoxidase, formation of squalene. And a few words about terbinafine now. Terbinafine, it not only inhibits ergosterol synthesis, but it causes accumulation of toxic substance squalene, which causes damage of membrane of fungal cells when it accumulates in. And it takes less time for the treatment, for complete recovery when terbinafine is used. As I said before, 12 months is needed for grisofulvin complete treatment, and only 12 weeks, not months, is needed for complete recovery from toenails onychomycosis when it is treated by terbinafine. Much less. And for the treatment of onychomycosis of hand nails, less time is needed, about 6 weeks, 1 month to 6 weeks. So you may read that adverse effects are not so serious, but headache, of course, is a very unpleasant adverse effect, which causes worsening of life of such patients. And let's look at sites of action of fungal agents. It is as conclusion of what I said before. Amphotericin B and other polyenes, nystatin, bind to ergosterol in fungal cells, membranes, and increase membrane permeability. So it leads to leak of potassium and magnesium ions and can result in fungicidal, but sometimes fungistatic effect. Effect will be fungicidal or fungistatic. It will depend on amount of ergosterol in fungal cell membrane. Then the imidazoles and triazoles inhibit 14-alpha-sterol demethylase, prevent ergosterol synthesis, and lead, don't forget it, accumulation of toxic 14-alpha-methylsterols in fungal membrane. Effect may be fungistatic, maybe fungicidal, depending on concentration of these drugs and depending on drug itself, because some of them have higher potency, higher efficacy than others. And now my question is it good to combine amphotericin B with azoles for the treatment of, for example, aspergillosis or candidiasis or some other infections? Who can answer this question? Do you understand my question? Who can answer? Well, maybe do you understand question or not? Who can answer? I would like one of you answer this question. Not? Can you answer or not? If not, say not. Cannot hear you. Наталья Геннадьевна, не слышит вопрос или нет?
Professor, I don't think that they can be combined.
Can amphotericin B be combined with azoles for the treatment of fungal infections? Is it good combination?
No, Professor, I don't think so. I don't think so.
Yeah, not. Can it be combined? Why? How do you mean? It is not optimal combination because amphotericin B needs ergosterol for its effect, yeah?
Yes.
But azoles inhibit synthesis, that is decrease amount of ergosterol in membrane. But amphotericin B is very good to be combined with flucytosine. How do you mean why? Because flucytosine must use permease, special enzyme for penetration to the fungal cells, yeah? But amphotericin B, it causes disruption of damage of cytoplasmic membrane. It will help flucytosine to enter into fungal cells. So this combination is considered to be good. Yeah, let's go on. The allylamines inhibit squalene epoxidase and prevent ergosterol synthesis. I said you that this is terbinafine, which is widely used only in superficial infections. So allylamines are used only in superficial infections, not in systemic. But they are considered to be the main treatment for onychomycosis nowadays. Then, Echinocandins, caspofungin. We discussed it before. What is the mechanism? Inhibition, formation of glucans in the fungal cell wall. Caspofungin is very effective against aspergills and candida, mainly against systemic infections. About flucytosine, we discussed recently. Griseofulvin also we discussed about. And about new group of drugs, the so-called hexabarols. You can see that they inhibit fungal amino acid tRNA synthase and therefore inhibit fungal protein synthesis. This at the step of translation. But this group is very new and we don't know about other characteristics of this group, which adverse effects it will produce and so on. And let's look finally at the picture, which represents the cytofunction of different drugs I said named you before. So, membrane function inhibitor amphotericin B, which binds to ergosterol. Ergosterol synthesis inhibitors, azoles, and terbinafine, naftifine also they both inhibit squalene epoxidase. Nucleic acid synthesis, DNA synthesis is inhibited by flucytosine. And cell wall synthesis is inhibited by caspofungin, glucan synthesis. And at last, synthesis of proteins because of inhibition amino acid tRNA synthase, new group of drugs, oxybarols. Griseofulvin is rather old drug, the most old. It was introduced in clinical practice in 50s and former century, but it is not withdrawn from clinical practice. It may be used only in superficial infections and orally, only orally. That's all. Thank you for your listening. Goodbye.
Может, у них вопросы есть?
А я остановить демонстрацию?
Нет, они вас слышат.
Да, слышно меня? Have you any questions? По-видимому, have no. Так.
You can ask questions about the whole course of pharmacology.
Whole course of pharmacology, and which questions of? About whole course of pharmacology. Ты знаешь, мне опять вот написали, что 10 минут осталось.
Ну ничего, вы сейчас закончите.
Ну да, да. Нет, но они задают вопрос или нет?
Ну, видите, тишина.
Тишина. Ну тогда все, переключить на демонстрацию.
Do you have any questions?
No, Professor.
No.
Professor,
Yeah.
I have one question.
Which
They said they're gonna lift the quarantine starting from next week. So we have our normal sessions in pharmacology in the building starting from next week, or do we still have?
No. You can go for a walk on the street, but not to the building. You can't go far from your building more than 2 kilometers.
Okay, thank you.
And you can't go together with somebody very close. It must be the distance about 1.5 meters between you. So that's why next week we can also prepare for you some webinar if you want.
Okay, thank you, Professor.
Choose the most difficult topics for you and send us
I think
requests.
that it is not only one topic. It is next.
Yes, for the whole course, yeah, because you have time to prepare. That's why ask topics that you would like to discuss.
Any topic, yeah. From
So,
first semester,
somebody
from
told-
second semester, it is not.
So somebody told me that Tuesday is better than Monday, yeah?
Yes, ma'am.
Not Monday. Because on Monday you will have what?
We have another classes on Monday.
MCQ, yeah? On Tuesday you have MCQ. When do you have MCQ test?
In pharmacology?
Wednesday.
For us, we have MCQ on 1st of June for internal therapy.
On Monday, internal therapy, but on pharmacology on Wednesday, yeah?
Yes.
Yes.
So we can make on Monday at 3 o'clock. You will finish propedeutics, yeah? Therapy, MCQ. And at 3 we can start webinar if you want. Or Tuesday is better.
Tuesday is better.
So then Tuesday 3 o'clock, but prepare the topics that we must discuss, yeah?
Okay.
Ну что, давай останови демонстрацию, а то уже сейчас меня скоро остановят.
Так это вы сами останавливаете.
Ну да, я говорю, остановлю, ну тогда уже все, ведь ты же не сможешь обсуждать уже больше ничего.
Да, так нам и не надо. Они сказали, они хотят во вторник.
Ну хорошо, все, останови демонстрацию. Goodbye.
Bye-bye.
Bye, Professor.